Hello and welcome to our substance abuse disorder presentation on methamphetamines. My name is Alondra.
My name's Jasmine.
And I'm Emma.
And today we are going to tell you all about methamphetamines, what it is, and why it is a serious social and medical dilemma.
So what is methamphetamine? Methamphetamine is a stimulant that speeds up our body systems and is prescribed for obesity and ADHD. Methamphetamine is an indirect agonist at dopamine, noradrenaline, and serotonin receptors. It is considered an anorexiant, which is used to suppress appetite and treat obesity. On the other hand, there is an illegally altered version of the prescription drug that is cooked to resemble glass fragments. Methamphetamine was developed as a synthetic alternative to ephedra, which is a botanical extract that has been used in traditional Chinese medicine for over 5,000 years. In 1885, the active alkaloid ephedrine was extracted from ephedra and studied. Japanese chemist Akira Ogata first synthesized methamphetamine in 1919 from ephedrine. It was made with the goals of CNS stimulation, bronchodilation, and nasal vasoconstriction. In 1932, the drug became marketed as an inhaler for asthma and congestion relief. It was available without prescription. Oral medications were introduced as a result of the inhaler's desirable side effects. Methamphetamine was used for many disorders despite it not being listed on the label. People use it for schizophrenia, asthma, alcoholism, migraines, cerebral palsy, hiccups, and more. During the 1940s and 50s, housewives, students, professionals were all using methamphetamine to improve their mood, promote wakefulness, and lose weight. Let me move this. Um, 1959 was when people started extracting the drug from medication and abusing it. In 1959, the FDA restricted the drug to prescription only. Abusers would combine the drug with other substances like heroin or barbiturates. In the 1960s through 80s, motorcycle gangs contributed up to 90% of methamphetamine produced in the U.S. at that time. They also distributed the drug along the Pacific coast. In the 80s and 90s, methamphetamine abuse occurred mostly amongst white males who worked blue-collar jobs. During this period, the drug increased in popularity due to its new smoked form that caused immediate euphoria. The Federal Controlled Substance Analog Enforcement Act of 1986 and the Chemical Diversion and Trafficking Act of 1988 were passed in attempts to regulate illegal production of the drug. Around the 2000s, many illegal manufacturers and distributors spread throughout the West Coast, and the highest demand in California. The Methamphetamine Control Act of 1996 was passed to strengthen penalties and precursors. The Combat Methamphetamine Epidemic Act of 2005 regulates the purchase of products containing pseudoephedrine and ephedrine, which can be used to make meth. Recently, there has been an increase in meth-related deaths within minority communities. Research shows the urgency of prevention, interventions, and treatment aimed for specific populations is limited due to structural racism and inequalities when accessing health services. A few statistics. So the first graph shows a trend of U.S. workers that tested positive for methamphetamine between 2018 and 2022. And then the next graph shows that between 2018 and 2021, the highest meth-related drug overdose deaths were amongst American Indians, Alaska Native men ages 15 through 64, and Black men ages 35 to 64. And within each group, men had the highest numbers.
Prices of methamphetamine on the streets. So street cost of the drug methamphetamine. The purity of crystal methamphetamine generally is much higher than powdered methamphetamine, and crystal methamphetamine typically commands a higher price. Nationwide, the cost of 1 pound quantities of crystal methamphetamine ranges from 10,000 to 30,000, compared with 3,500 to 20,000 for powdered methamphetamine, according to National Drug Intelligence Center. It's by pound, ounce, and gram. Powdered and crystal have different pricing. Common names for methamphetamine. Common names used for methamphetamine on the street is meth, speed, crank, ice, chalk, crystal, glass, tina, yaba, trash, tweak, and uppers. Methamphetamine affects the brain. So how does methamphetamine affect the brain? Methamphetamine is also known as meth, affects the brain's central nervous system. Methamphetamine is a highly addictive stimulant according to research. Methamphetamine increases the release of the neurotransmitter dopamine, which stimulates brain cells, enhancing mood and energy. Dopamine is a feel-good chemical and is like a natural reward system in which the individual becomes super addicted to methamphetamine. Smoking or injecting methamphetamine results in intense euphoria and is often associated with binge use, large escalation in dose with rapid tissue tolerance, and high rates of addiction. It is an addictive drug due to the stimulant of euphoria effects.
Side effects of methamphetamine. There are two main categories of side effects relating to methamphetamine use, physical and psychiatric. These side effects vary depending on each individual's case with drug abuse. Not all addicts will experience the same effects or severity as others. Physical side effects such as teeth grinding, skin picking, and shaking are very noticeable signs of meth abuse and are commonly seen with individuals you may encounter in a normal setting. While increased, oh, sorry, can you go back? Sorry. While increased blood pressure, body temperature, heart rate, and breathing rate are clinical manifestations of the disorder that can be measured. On the other hand, we do have psychiatric side effects such as anxiety and paranoia, hallucinations, and compulsive behavior. On the bottom right of the slide, you can see the before and after of a meth addict. In the left photo, the woman is 22 years old, and on the right, she is 33 years old. You can see that she has hollow cheeks and thin lips. This is a sign of malnutrition, and she looks a lot older than her age. Treatment. Treatment abuse is a pressing public issue, and as of now, there are very few treatment options specifically for those with economic difficulties. Currently, there are no FDA-approved medications for the treatment of meth dependence. The three most common treatments for meth abuse are contingency management, residential rehabilitation, and 12-step programs. Contingency management is the most effective. It is a systemic reinforcement of desired behaviors and the withholding or reinforcement of undesired behaviors. Residential rehab is known to be most effective in the first 3 months following detoxification, but it is very expensive and they tend to feel very isolated. 12-step programs are the most economical, they're the most accessible. However, there is no medical or clinical treatment. It is faith-based and it is limited to addiction, whereas some patients may also be experiencing anxiety and depression. Recovery. Methamphetamine is a highly addictive and powerful drug, therefore recovery can be extensive and complex. The average recovery rate for people suffering with methamphetamine addiction is 37%. However, without formal treatment, only 1 in 9 users will remain abstinent for 3 months, and only 5% of users will maintain sobriety after 3 years.
So, you may be an addict if you have poor performance / attendance at work or school. Are you withdrawing from responsibility and socializing? And do you feel isolated and lonely?
As well as are losing interest in activities, hobbies or events that were once important to you? Are you having financial difficulties? Are you developing a high tolerance for meth and using higher doses?
Are you experiencing changes in appetite? Are you running into legal troubles because of meth? Are you lying to friends and family about meth use? And are you denying a substance abuse problem? If you are any of these things, then you may be an addict. And this next slide is for you. Thank you so much for listening to our presentation. I hope you really enjoyed it, and I hope that you learn more about methamphetamine abuse and why it's so important that we get a hold on this problem in this country. Thank you.
Thank you.